So every time I'm going over the birth preferences creation in my childbirth prep classes, women always look at me skeptically and ask, does anybody really pay attention to the birth preferences? And my answer is always yes, absolutely yes. It is, number one, it is your total right to create these preferences, to create this positive intention for how you would like your birth to unfold if special circumstances do not arise. Of course, it's important to go into birth understanding that we don't know exactly what will happen. And it is important to have flexibility if an emergency, for example, arises, or sometimes women simply change their minds about birth preferences. The nurses during my birth were incredibly respectful of my birth preferences, and I'm the one that ended up changing some of them. I asked for no vaginal exams in my birth preferences, and then I ended up saying, can you ignore that and give me vaginal exams, please? So just because you're writing the birth preferences doesn't mean that that's like exactly what the birth will look like. But again, it's this really empowering experience to create them. It helps you realize that this is an experience that you are co-creating with the medical care providers, with your partner, that you're not this patient that should just allow people to do whatever they want to you, that everything that happens in birth is your choice. You get to make the decisions. And again, you get to make this list of preferences that sets the intention for how it all unfolds. So absolutely yes, people pay attention to the birth preferences. And if somebody tries to not pay attention to your birth preferences, you have every right to make them. And if, say, for example, you have a care provider during pregnancy that's like, don't write birth preferences, it's not worth it, I don't pay attention to them, that's a pretty good sign that you should find a new care provider. And then during birth itself, if somebody is trying to ignore your preferences, stand firm and advocate for yourself, or have your doula or your birth partner advocate for you, because you have every right to have your preferences respected in the absence of a medical emergency. Okay, so part of the resistance some care providers have with birth preferences is they feel like it's the woman threatening their position of power, or questioning their ability to keep you safe. So when you present the preferences, you can absolutely say, look, if your medical expertise is needed, or some circumstance comes up that makes one of these preferences, honoring them dangerous, of course I'm willing to bend. Ultimately, I want myself and my baby to be healthy. And I'm not trying to tell you how to do your job, but I'm not sick. I'm not a patient. I'm a woman that wants you at my birth just in case anything goes wrong. So it's a very different doctor-woman relationship than if you were a patient. So again, you're not a patient. You're a woman that has them there just in case. So again, you're not saying, I don't trust you or anything like that. It's saying, if at all possible, this is what I want to happen. And again, you have every right to do that. So what to do? Create those birth preferences. Create the birth preferences, contemplating what you would like to happen ideally during the onset of labor, active labor, baby's descent, an emergence, baby's care, and your care afterwards. Write down everything that you can think of that you would like to happen. In the description below, I have a link to sample birth preferences that you can download and you can edit, take away anything you don't want, add anything that you do want. This is creating these preferences. It's helping you plant the flag that says, unless my health or baby's health becomes tenuous, this is how I want my birth to unfold. And I have the right to change my mind at any time. So it's a really empowering experience to create these and then eventually share them with your care provider, which I'll get to in a second. So as you phrase the birth preferences, it's important to phrase them in a more positive tone. And I believe most of the birth preferences in the sheet that I provide are in a positive tone, but I could be wrong. This helps to prevent defensiveness. It helps to prevent your care provider from being like, don't tell me what to do. So for example, instead of saying, or you would say, I would prefer to labor without medication instead of don't offer me any medication. So we're trying to stay away from don't, or like, you have to do this. It's like, this is what I would prefer. Okay, keep it to 1 page. This will increase your chance that the birth preferences will actually be read. Of course, if you want to make it longer, you can, but it's unlikely that the nurses who are probably in a rush are going to take the time to read like multiple pages. But if it's on 1 page, there's a good chance that they'll read all of it. So that means that probably only your most important preferences will make it on there, but of course you can also verbalize any minor preferences. Just because a preference isn't on the list doesn't mean it can't be a preference that you advocate for. Then finally, share them with your care provider. Take them to a prenatal appointment at around 34, 35, 36 weeks gestation to go through everything, to see if there's anything they might push against, to see if anything goes against hospital protocol. If it does not mean that you need to take it out. It just means that you might need to prepare yourself for, not a fight, but to like advocate for that preference. Have extra copies. Ideally, your care provider should make sure that your birth preferences make it into your medical chart, but that might not happen, so bring extra copies. Again, adopt an attitude of adaptability, knowing that things might need to change. And then being thoughtful about any preferences that you let go of. Because again, you might need to let go of some, but that needs to be your decision, not anyone else's. So if somebody's suggesting that we might need to bend this, if it's not an emergency, take the time to contemplate your options, to ask about alternatives, to ask about your options, and make a decision that makes you feel good and makes you feel empowered. I had a mom recently that pretty much had every single one of her birth preferences change, but because she was the one that made all of the choices, she still had a really positive birth experience and felt empowered. And something that I'll close with is an interesting finding that was published in the Journal of Perinatal Education that found that a woman's positive and negative perceptions of her birth experience are more connected to her feelings and ability to exert choice and control during birth more than the specific circumstances of her birth. So to wrap it up, make those birth preferences. You have every right to make them, and they should be respected as much as possible. Let me know if you have any questions in the comments below.